you feel it's unfair, you feel sad, but as a forensic odontologist or forensic practitioner in general, we must avoid partiality. So we must be impartial. Yeah. And then when we give opinion, it must be within our expertise. Right. I will show examples through cases. What do I mean by within expertise? And we must also acknowledge the limitations of our technique. Yeah, what we do, we have to acknowledge. Yeah, it's not that we can do everything. Okay. So what types of opinions a forensic odontologist give? These are the type of opinions. First, identification of dental structures, then injuries sustained to the teeth and other oral structures, or injuries caused by teeth, abuse, negligence, and malpractice. So today, I'm going to give an example for each of these type of opinions, but not malpractice. But for malpractice, I can give an example now, which is if, in certain countries, for example, they do have dental insurance. Yeah. So what happens sometimes it's either the patients or the dentist will do false claim to the insurance. So this is when the insurance will report to the police if there's any suspicious claim, and the police will refer the case to forensic odontologist to do further investigation. So this is an example of malpractice. For the other types of opinions, I will go through in the next slides. So first, I'll start with identification of dental structures. This is the most, I think, basic knowledge that a dentist should have, not just forensic dentists. So we expect forensic odontologists or forensic dentists to be able to identify dental structures. So I'm going to show the first case. Yeah, this is the first case. Where odontologists were asked to provide opinion concerning the finding of a tooth in cave. So this tooth, yeah, has been found in a cave in Malaysia. So for laymen or public, they just see this as tooth. Yeah, they won't know that this is human or non-human tooth. So what they do, they will report to the police, and the police will report to the concerning authorities, and it will come to odontologists. So we have to be very thorough on the morphology of human tooth, and from there we also have to compare if there are any other species that have similar tooth structure to human. Yeah, we have to do an in-depth analysis. So in this study, or in this case, what we have done, we have not only just analyzed the tooth morphology externally, we have sent this tooth for 3D imaging analysis, that is CBCT, and also micro-CT to see, yeah, to examine the tooth holistically inside, yeah. Although this is only a tooth crown, but we still able to analyze and also compare with other species. Yeah, and I want to emphasize that although we know this is either human tooth or not non-human tooth, we have used a lot of published scientific papers to support our finding, or to argue with other papers as well. So what I want to emphasize here as well, that's important of publishing your findings. Yeah. People say, you publish, nobody read. No, people read and people use it. So in this case, we did a lot of studies as well to make sure that we come to a suitable opinion. Okay, this is another example. So this tooth was found by pedestrians somewhere in a housing area. So this tooth has been uh, given to a police to a police, and they have reported, just in case, yeah, if this can help in missing person cases. So in this case, yeah, what do we give? What opinion do we give other than we say, oh, this is a human tooth, based on the morphology and all. We also can estimate age based on the tooth. Yeah. However, remember, we have to know our limitation. We do not know if this tooth came, from a dead body, or we do not know that this tooth um, was just thrown by someone. Yeah. So we cannot, if we do not have any other information that could associate the tooth with the circumstance. Yeah. We just don't go to that level. Yeah, we must know our limitation and the information that we have at the time. So we have to be careful, yeah, and cautious when we do the report. We actually, whatever analysis you want to do, you can do. But when you put in words, when you prepare a report, this is when you have to be very careful, as this is what will determine, your fate later. Because from this report, you may or may not be called by the court, and you have to explain of what you have written. Okay, next, we go to the second type of opinion, that is injuries sustained to the teeth or other oral structures. Okay, this was a case, I think this year. Oh, last year. This was the last year case referred to me and Dr. Amir. It's a diseased person, believed to be a 40-year-old female, was allegedly abused. So we were called to do thorough examination on the oral and maxillofacial region. So as you can see here, there's a loss of tooth in front. So the history of this case, according to the employer, yeah, she was found dead in her employer's house. According to the employer, she's just not well for some time. She's been unwell for quite some time, and on top of that, she was having diabetic hypertension. Yeah, so she's not eating well according to them. So her condition just deteriorated by time, and she just fell down and she passed away. So it was suspicious. The family members reported this case, and that's when we were called by the pathologist to give opinion on the oral and maxillofacial region. So maybe for a normal person or public, when they see, like, okay, you just fell down, right? So that's why your tooth came out. Yeah. So, but for us, we have to go to the depth, to the alveolar socket, to really see what could have actually lead to this condition. Yeah, we don't just see it as, okay, maybe the patient just or the disease just get her tooth taken out a few days ago, right? They can say, like that, but we have to analyze properly what could have happened. So from postmortem's finding, yeah, we found that not only that the tooth socket of 2-1 was there's a missing tooth one. Yeah. We found based on the X-ray taken. Yeah. We took an X-ray and we found there's a retained root, right? So that's a retained root there. Okay, but still we do not know, or we could not say, oh, this could have been just, a person who fell down, fracture the tooth, and it just fell out, or the tooth has been extracted, but the tooth just broke. Then we also found a fracture on one. Yeah, we found lacerated labial frenum. Okay, these are important findings for us to guide us to come to conclusion. Okay, then we also found a notch on the incisal edge of tutu, and then lacerations on the lower lip. Other than that, this one we considered as above the neck, so we still examined this finding. This is cauliflower ear. We call as cauliflower ear. So before I explain the conclusion, why is it all this important, and how do we come to conclusion? Okay, this is when we use all our dental knowledge, all our what we have taught. Yeah, you see right here, that's a fracture of one. Okay, and this is a jagged fracture, means it is recent. Yeah, this fracture is recent. It is not smooth yet, so it's quite recent. And here you can see that there's a lacerated labial frenulum, and also this tooth has been has fractured at this area. Okay, this I will explain in detail later, but this finding was consistent with an impact, has been directed at the front region. Yeah. And then next, if you can see here, there's this lower lip is lacerated. Then there's a notch of incisal edge. Most probably, yes, this disease, had previously fell down with the face went downward. Yeah. So these all were in published literature, yeah, to support our finding. And this cauliflower, all right, yeah, this was consistent with or we call as boxer ear, yeah, where means there is a substantial impact has been applied on this disease ear when she was alive. Yeah. So next, the conclusion. Now we look at this injury pattern. Yeah, the injury pattern. We suggest that there's a recent trauma, okay, due to substantial impact on the front tooth region. But here we have to be very mindful. We could not say the trauma could be caused due to a punch or due to hit by something. We have to, we could not come to that. So we have to be very mindful. We have to give evidence, have to explain the evidence in a way we know that we only know until that. We couldn't, because if we say like this, for example, we say here, suggestive of recent trauma due to substantial impact on the front tooth region. If we add another sentence, like we said, for example, this could be due to a punch on the face, right? That is dangerous already, because that if we were asked, we could be asked, how can you approve that, right? So be very mindful. Although you it's like 99% you say yes, this must be like a substantial hit on the face, you you want to say that, this disease has been a smack on the face, but you have to keep that to yourself. Yeah, be very cautious when giving opinion. So so I want to explain to you in detail how we do, like we say, this is a fractures by frontal impact. Yeah, we actually did in-depth study. Okay, if horizontal crown fracture, um, fracture at the neck of the tooth, if the directions of the fracture is oblique, or the oblique, there's an oblique root fracture. We did study what could be the directions of the impact. So that's how we do our reporting of our opinion. Yeah. So for example, for this one, enamel fracture on the 1-1, yeah, we found out that usually it caused by direct impact on the labial surface. Yeah, and the force or the impact is usually in horizontal direction. And for 2-1, which was missing, but actually it was fractured at the root region, we found out that from the literature that usually in this kind of fracture, the tooth was subjected to vertical force. Yeah. So whatever opinion we give, we will find a support literature to back us up. So this was one of the paper that we have referred to. It was a nice study. This shows how the directions of the impact could actually determine the fracture pattern. Quite a nice study. Actually, right, when we did all these cases, it gave us insights to it opened up our eyes that, oh, there are so many research that could be done, that still need to be done, yeah, in order to help the practitioners, clinicians out there to perform their duty. So that's the beauty of being in this university setting. So the workflow in that we have done, or when we perform study, or when we do case to give opinion on injury related to the teeth. So first, documentation. Yeah, remember the elements that I explained in the second slide. So documentations. Yeah, we take the proper history. We do charting. We take photograph. We took X-ray. If possible, or if available, we will also take 3D scanning like CBCT. But that one based on case to case. Yeah, type, case to case type. Yeah, then we determine the type of injury, the location, dimension, and characteristic. Then we interpret, and again based on scientific data. And for reporting, yeah, we make sure that we include a chain of evidence. Yeah, this is very important. Even not only for forensic, but for law, they will scrutinize us on chain of evidence. We describe, we analyze, we also present our limitations when we report, and then we come to our conclusion. So we do extra oral examination thoroughly. Yeah. Whatever we see, we will note down. Yeah. That we do intraoral examinations thoroughly. Yeah, not only teeth, we do look at the gums, the palate. Yeah. Then we have to determine the injuries. Is it hard tissue injuries, soft tissue injuries, And when we want to use this term, we have to make sure that it is the correct term. We have to know what is abrasion, what's the difference with contusion, laceration, incised wound, and stab wounds. So the choice of this word, yeah, everything that you put in your opinion, or in the report, should be checked, you have to be very mindful, very thoughtful, and it is best for you to do the case with at least another forensic odontologist or another expertise. Yeah. Okay, next is next type of opinion is injuries caused by teeth. Yeah. Okay. So I think I've been talking for quite a while, almost 20 minutes. Yeah. Um, okay, I have a question. Okay, for those who have not attended this lecture of mine, right? Do you want to try to tell what type of injury is this? Anyone who's been listening and now want to try to apply your knowledge? Does anyone want to tell me what kind of I'm not sure if your mic is mute, but if anyone wants to raise up hand and tell me what is this, just look at the nobody. Okay. I guess many of you say that this is, let me just see if anyone want to raise up your hand? Want to put in chat box? What is this injury? This was on skin? Nobody?
There is
Okay.
answer in chat box, doctor.
Okay, chat box. Sorry, I cannot see the chat box actually. Let me just look at where is the chat box. Oh, chat there. Okay, thank you. Oh, Dr. Arofi and Katrina. I think Dr. Katrina must be. Bite mark injury. Okay, thank you. Okay. Prof. Vicky, thank you. Bite mark. All right. Okay. At first, when I saw this, I said bite mark. I said bite mark. Definitely. Right? Okay. So this was a case, a real case, referred to my former supervisor when I was in Adelaide. She was referred with this case. And she said, right, even for her, who had done the work for by then she said like 20 years, and she said like this was the first time she felt like something is not right with this bite mark. She has not come to a conclusion that this is bite mark, but she said because when the case was referred, the victim, yeah, the alleged victim said, I have been attacked by a man, and you know, the man has actually I was bitten by this man. I was bitten by this man at the buttock region. So of course, women come report, being sexually assaulted. It's easy for us to believe, isn't it? So this photo was taken and given to forensic odontologist, my supervisor. But she said like she didn't buy that this is bite mark, but she couldn't prove that this is not bite mark. Yeah, because when it was referred, it was said like this is a bite mark. This woman has been bitten. So but she took her time. So remember, always if you think you need time, you don't rush. Don't rush. If you feel that you need more time, you always take your time to study a case which you feel you need more attention. So she said it took her more than I can't remember, but more, I think 1 week or more right? So one day, yeah, she went to a market and she bought a drink, She said while thinking about this case, it just couldn't get off her mind. She said like, she has to solve this case, settle it. But at the time she drank from bottle. Okay, you know the bottle, right? Like not your tea bottle. This is the glass bottle, like in Coke, you have that um the cap, right? The jagged with jagged border. So she opened and she was thinking, it looks so familiar. So what she had done was she brought that back to the office, yeah, and she had done the bite mark analysis procedure. So what happened was, uh, okay, okay. So she done the standard procedure for bite mark analysis, and this was the bottle top. Okay, and what she did was she superimposed, and there you go. It fit the so-called bite mark injury just now perfectly. Okay, so what do we want to tell here? We have to be very cautious. Yeah. Our first thought, we keep it, we analyze first, and then only we come to conclusion. So she had actually published this as a case report. You all can, find it and read about it. It's bite mark or bottle top. It's very interesting. So yeah, for further detail, you can go to this case report. Yeah. Okay. So what is bite mark? Of course, bite mark is a mark caused when someone bites something. Yeah. Of course, someone has to have teeth. But okay, it's not only teeth that cause the mark, but it is also the act of suction. When someone bites, someone will suck, and that causes the depth of the mark. Yeah. So either alone or in combination with other mouth part. And then along with teeth, there are saliva as well. So that is a trace of evidence that could go for biological analysis. The workflow, again, the basic of the workflow for all the injury analysis is the same. Yeah, we have to go through all these elements: recognition, we collect it, document it, analyze, and then report. Okay, so this is a classic characteristic of bite mark. Yeah, if you found a bite mark which is perfect, means it has all teeth marked there from molar to molar. Then something is not right. You have to think about that. Why? Because when we bite, right? Let's say we have a burger and we bite, it does our biting action only limited, maybe up to premolar. It won't go more than molar, right? So it's a circular or oval injury. Of course, it consists of two opposing arches. Yeah. Then usually in the act of a vigorous bite, it will come with or associated with abrasion, contusion, or laceration. Yeah. It also will reflect, the shape, size, or arrangement of teeth. But remember, usually it goes up to premolar. It won't be like so perfect for all the teeth to, to be involved, okay, or to be shown in the bite mark. Unless you are Julia Roberts. She smiled from molar to molar. So if you ever found that, you can suspect Julia Roberts, yeah? Okay. So once a pattern injury is established, firstly, not only you say, oh, there's a bite mark. This must be caused by some, person, one by a person, you know. No, we have to go back. Is this caused by human or animal? Yeah, it could be caused by a dog. All right. There's bite mark caused by shark. So we have to determine from human or animal. Then when we determine, oh, this is human because this and this, then we have to determine it's adult or child. Yeah. And if it is recent, yeah, swap for DNA analysis, we have to bear in mind that um, that again, that is not just a bite mark. There's a biological evidence that left there. That is saliva, if it is still recent. Yeah. Then we have to think, where is it located on the victim? Yeah, which part? Because that could help us to determine, oh, this could be a self-inflicted. Yeah, is it fresh or is it the scar? Because from there we determine do we proceed or not with the analysis? Is it worth to proceed with the bite mark analysis? Then the positions of the biter, we could give opinion, by looking at it. Okay, the person, could have bite from the back, and that will give the idea or give the picture of the circumstance, because position of the biter can give you the idea, oh, this may be the act of self-defense rather than the act of attacking. Yeah, that could help the forensic investigator. That, yeah, is it offensive or defensive, self-inflicted, yeah, or is it actually affectionate, it's out of love, or is it violence? So all this we have to address. Yeah, so these are some example, yeah, where bite mark, is not as perfect as this. When it is presented to you, usually it come in this form. Yeah, contusions, yeah, lacerations, um, and then we have to consider all these, the person skin elasticity, the site on skin, the force applied, age, sex, race, yeah, all this we have to consider before we proceed with uh, analysis. Yeah. Okay, this was a case referred to us. Yeah. As you can see here, it was this kid, this child was allegedly abused by the carers, but the carers claim that all these bite marks were caused by this child's sibling. Yeah. But for us, right, when we want to do this bite mark analysis, we see these are scars and it has been like quite while ago. So is it worth to proceed? Can we proceed? So we 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 have to um, acknowledge our limitation. If we cannot proceed, we have to tell that we cannot proceed, because in this case, we can't even like see a proper bite mark. Yeah. So we have it's in certain cases when you know your limitation, you just cannot proceed. You have to just tell them. Yeah. So that's about our case, and this was a famous case. I think it's worth to share, where bite mark has been used to convict serial killer. So this guy, Ted Bundy, from Florida, he was not just a serial killer, but also a serious rapist. So his his last victims, yeah, Lisa Levy and Martha Bowman. What happened? They found a bite mark on one of the victims, and that it was analyzed by a forensic odontologist. Yeah, luckily he has this. It's quite lucky. Yeah, he has such teeth. Yeah, that could give such a bite mark, and then he has this such arrangement. Yeah, quite the crowding. Yeah, and this was actually the first case in Florida where bite mark was used solely to convict the suspect. Yeah, so it's quite prominent, this case, yeah, because it was the first time bite mark was used, the only evidence used to convict a killer. Okay, this is another case. This is actually the case of my former um, uh, a former forensic odontologist in UM. Yeah, it was shared to me. So this girl was found in a suitcase. Now, what happened was, um, the suspect also at the time was her boyfriend. Reported to police that uh, his girlfriend went missing. Yeah, so he has actually helped. Okay, give cooperation to the police in finding his girlfriend, and that has actually cost him, because while he was with the police, cooperating, finding, searching for the girlfriend, um, the police actually noticed that there was injury, or there's a injury on his skin. Yeah, so this was his skin. That this was his skin. So a forensic odontologist was called, yeah, and analysis was done. So what uh, the forensic odontologist did was, he had taken impressions of the victim, yeah. Then impression also taken for for the guy, and based on superimposition analysis, it was found that it match, yeah, it match the teeth pattern match with the injury um, on the suspect skin. So in this case, this report, this bite mark analysis report has actually helped, um, or has actually contributed, resulted in the convictions of the suspect. Yeah. So this was the case. Yeah. So bite mark analysis is not bite mark comparison or matching. We are not trying to match like this. We are not trying to match it, but we analyze it first, and then only we say it matches. Not that when the moment we say, oh, it's matched, we have to do a proper analysis. Yeah. So I won't go into detail of this, but what I want to emphasize here is, when we see a bite mark like injury, we have to establish first either this pattern injury, uh, uh, is caused by human or not. If this no, if this fit the characteristic of bite mark. So 63% of bite mark, not bite mark, and it's just bite mark, but 60 that there are so many wrongful conviction in the US, yeah, but 60 and these wrongful convictions has been determined based on DNA analysis. So 63% of these cases were due to error of the forensic expert opinion. Yeah. And 50%, more than 50% of this 63% were due to mishandling of bite mark. Yeah, you could see like how bite mark analysis becomes very controversial. In the US, for example, they have this project called as the Innocence Project, where they are trying to help those who were wrongly convicted, yeah, but of course using a fair system or scientific system, yeah. This is one of those wrongful convicted case made that this person was convicted based on bite mark analysis alone, yeah. For 10 years, he was jailed for um, the the crime that he did not commit, yeah. So what happened, DNA analysis was performed, and it was shown that the saliva and blood found on the victim was not of this person's, or the name is Cron. Crons belong to Cron. It belonged to another actually another person who was actually at the time already incarcerated, yeah, by another offense. So he was exonerated. This was one of many cases, yeah, where bite mark has been used to convict. So again, bite mark was very controversial. So you can go into the this website to see, you know, or to see or to read on those wrongful convictions. Okay, so the controversial or the issues with bite mark are how unique are actually teeth. How can someone say, or how can I say that nobody else in this world has the same pattern of teeth as mine? You know, even if I want to do research on it, I just could not, because we have like what 8 billion, 6 billion populations in this world. So it's so difficult to prove that, you know, our teeth are unique. Yeah. Then is the injury pattern a true representation of the objects that caused it? And how accurate is actually our analysis? So we have to really look into this, yeah? So these days, in the workflow or in the procedure of when bite mark was found, they always suggest to do swab so that it can be supported with a DNA evidence or biological evidence. Yeah. Okay, I'm gonna go for the last type of injury, which is child negligence. This case was actually very recent, few days ago. I thought, like, you know, why didn't I share? Because um, after I involved in quite a number of cases, this was the first time this kind of case was referred. So it's a new experience to me. I say it's a good case to share as well, because you never know what type of case that will be presented to you. So this case was referred to me a few days ago. So for this case, right, this child died in at her home. Yeah. Uh, what happened was the parents claim that, you know, she had been sick for a while, okay, and she had been sick, she had difficulty in breathing, and so on. However, she was not brought to the hospital to seek for medical treatment. Yeah. So, but what is expected for us forensic odontologists to do, isn't it? So in this child negligence, so in this case, we were called to not to identify the body, to take as much as to examine the oral region, maxillofacial region, then to just give opinion on what we see. Yeah. So that's the teeth of the child. Yeah, you can see those are not caries. Those are just generalized staining. Yeah. Um, it's quite brownish. Yeah, and we did this postmortem. And what happened was this child was most likely no, this child was actually brought to a hospital once and was diagnosed most probably to have osteogenesis imperfecta. But after that, following to that, the parents never brought the child to get medical to seek for medical aid or medical help. So that is the negligence part. Okay. So here, what we have to do is we just have to examine to the oral and maxillofacial part. So we actually had taken out few teeth for histological section. And this is when we extracted the teeth, as you can see here, right? This will actually teeth that were still in the bone. It have not erupted, so it's in the bone. But you can see there is a hole here. This is actually not caries because it was still in the bone. This is pitting, yeah. And when this is 4-6, and this is 4-7, and this child was said to be um 5 years old. So for a 4-6 at 5 years old, we expected the root to have at least formed. Yeah, at least half, or it has formed, but not in this case. Then we also took out another tooth that is still developing, that is still inside the bone mandible. That is 4-7. You could see how small it is, right? Comparatively with fossils. And this was the root part. It was not a root. It's a very soft. It's very soft. We do not know why it's like this. So now it is. We have sent it for histological examination, pathohistological examinations. Yeah, and we took X-ray. This X-ray, skull X-ray, was shown to us. Yeah, the appearance. Uh, con, uh, cons the appearance is consistent with osteogenesis imperfecta. And then we took IOPA, full mouth. We did a full mouth survey, as you can see, for the deciduous teeth. The pulp chamber, the root canal are so large. Yeah. And then the enamel is quite thin comparatively. And we know that dentigenesis imperfecta is most likely associated with osteogenesis imperfecta. And then you can see here, this is the developing permanent premolars. See, this should be enamel, isn't it? Look at the density. The density is quite low compared to the enamel of this deciduous molar. Yeah, so all these were examined, yeah, and this was the 4-6 just now, yeah. You can see that the enamel of 4-6 is still dense compared to the 4-5. So we could see the pattern of deteriorative disease in this child. But we haven't come to conclusion. It is still it's still under analysis. Yeah. So this was the first case of such bone disorder related to a child death that has been referred to us. So that's all from me. I think I finished slightly early than the given time. But I thought we just, we can have time for question and answer if that's so. So thank you so much. I hope I have shared with you something that could be valuable and useful for all of you. You can connect with me through my Instagram or ResearchGate or my email, which was shown in the first page just now. Thank you so much.
Yes, thank you for your presentation, Dr. Rabia. Okay, next we have a 10 minutes Q&A session. You can raise your hand and I will invite you to ask question directly. So is there any question to Dr. Rabia? Or you can type your question in the chat box.
Okay, someone actually said just now.
Okay, Dr. Arafi, please ask your question.
Okay, thank you very much, Dr. Beta, and thank you very much, Dr. Rabia, for your interesting presentation. I have one question here. My question is, what are the challenges faced by forensic odontology to analyze the maxillofacial injury to solve the criminal case? Thank you.
Thank you, Dr. Arafi. Okay, the challenges are a lot, of course, a lot in analyzing. First of all, I think because there are not many of us in this field, doing it alone or doing it with just another forensic odontologist, I feel that is a big challenge because we need to, when we analyze uh, um, this injury, right? It is subjective. So we could analyze as much as we want, but when it comes to this subjective matter, we do not know, is it our analysis is enough, or is it too much? What should we put in our report? Should we put all of our analysis, or should we limit at certain point? I think that's the challenge. To 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 perform analysis, okay, but to come to a conclusion. So and of course, when we, like I said before, another challenge was, another procedure that we did was, whenever we give opinion, we have to find published literature to back us up. So the challenge is sometimes um, certain opinion that we give, there is lack of published evidence to support. There is, but sometimes those publication is not really sufficient to support us. So that's another challenge. Yeah. So I hope that answered your questions. So
Thank you very much.
yeah, welcome.
Okay, thank you. Is there any question from the other?
If there's any question that you think you have later, you can always contact me through my email or my social media, or else you can just always ask Dr. Beta or Dr. Arofi as well. Yeah.
Okay, I think there is no question anymore, so I will close this session. Thank you, Dr. Rabia Al-Adawiyah Rahmat, for a wonderful session. We also would like to give a digital certificate of appreciation to Dr. Rabia Al-Adawiyah Rahmat, who has been willing to give a lecture and be our amazing today speaker. The certificate will be handed over by Professor Mika. May I request Prof. Mika to give the certificate as an appreciation to Dr. Rabia, our first speaker today.
Yes, thank you, Dr. Peta. So we would like to say thank you for providing this afternoon lecture to Dr. Rupiah. Thank you very much once again. So we gave you a certificate today. Thank you.
Thank you so much, Prof. Miki. Thank you, Dr. Beta. It's an honor to give this lecture. Thank you.
Thank you, Prof. Mika. Thank you, Dr. Rabia. Please feel free to tune in until the last as we will have photo session together at the end of this event. So, ladies and gentlemen, for the second session, I invite Dr. Arofi for lead this session. For Dr. Arofi, time is yours.
Thank you very much, Dr. Beta. Thank you very much for Dr. Rabia and also Prof. Mika. Okay, ladies and gentlemen, we move to the second session of this Stovit online series today. Now, let us proceed to our second lecture. And we are privileged to have Dr. Amir Haswan Abdul Rahim from the Faculty of Dentistry, University Malaya, who will be presenting on the topic about, Dr. Amir will present a topic about current updates on dental age estimations, research, and its practical application. So please join me in welcoming Dr. Amir Haswan. Hello, Dr. Amir. How are you?
Hi, how are you? Good, thank you.
Thank you very much for joining the session, Dr. Amir. So please allow me to introduce our speaker today, Dr. Amir Haswan Abdul Rahim. Dr. Amir from Faculty of Dentistry, University Malaya. Dr. Amir is a dental lecturer and forensic odontology specialist at the Faculty of Dentistry, University Malaya. His doctoral dissertation investigated, let's see. Okay, his doctoral dissertation investigated the reliability of staging method for dental age estimation with research interest in oral and maxillofacial morphometric analysis, facial and dental identification, and the application of plain and advanced imaging technique in forensic odontology. Recently at University Malaya, he is responsible for human remains identification through dental autopsies and dental age estimation, particularly for undocumented children. In the past, he has been involved in the victim identification of the Wang Kelian mass grave and the 2016 Brussels airport bombing. Apart from his administrative duties, he is involved in the undergraduate forensic odontology and oral and maxillofacial imaging curriculum, as well as clinical and research project supervision. Dr. Amir's education, he was graduated from International College Mara Painting 2005 and Bachelor of Dental Surgery from Queen Mary University of London 2012. Dr. Amir got his Master of Forensic Odontology from Catholic University Leuven 2016 and Doctor of Philosophy in Forensic Dentistry from Queen Mary University of London 2023. Okay, Dr. Amir, time is yours.
Thank you, Dr. Rofi. Assalamualaikum warahmatullahi wabarakatuh, and good morning. First, I would like to thank Dr. Rafi, Dr. Beta, Prof. Mike, for the invitation and for the opportunity for me to speak today. I'm going to share my screen. Okay, I hope you can see my screen. First, I would like to apologize if my connection becomes unstable. So throughout this morning, it was okay. And when it was my turn to speak, suddenly it becomes unstable. So just hopefully nothing happens. Okay, I'm just going to... All right. So I'm going to speak or talk about dental age estimation and current updates and the involvement of UC Malaya in research and the practical application in age estimation. Okay. I hope you guys like to listen a little bit about history, because myself, I'm certainly fascinated by history and you know how things have changed and evolved since in the past. All right, so I'm just going to talk about one person today. This is Queen Mary, Queen of Scots. She lived in the 16th century. And this next to her is her Elizabeth I from England. So these two queens were related by blood. So they came from the Tudor dynasty. How they are related? Okay. First, Elizabeth was half sister to Mary I, which is Bloody Mary. And Elizabeth was the daughter of Henry VIII, who had 6 wives, famously or infamously. And how Mary was related to Elizabeth is Mary's grandmother was Henry's sister. So that's how they were related. Okay, so the history, Mary's history was quite interesting. When she became Queen of Scotland, when she was only 6 days old, her father died without any male heir. So she was the heir apparent, and she was queen at the age of 6 days old. And at the age of 9 months, she was coronated and she became officially as Queen of Scotland. And at the age of, 6 years, not 6 months, at the age of 6 years, she was sent to France to get engaged to Francis II. So Francis II was the heir apparent to the French throne. So at the young age of 6 years, she was already sent to get engaged and marry Francis II at the age of 15 years. Became Queen of France, at the same time Queen of Scotland, 16 years old, and then returned to Scotland after Francis' husband died 2 years later. So in her 18 years life, she's already done everything that I haven't done to get engaged and get married. But that's the timeline for Mary. She became queen at the age of 6 days old, and she was not obviously she was not mature enough to become or to rule Scotland. So her role was taken over by her representative, who was an adult. One of them was her mother at the moment, at that time. So when she became of age, she became more mature at the age of 16 and 18. She went back to Scotland to rule. At the age of 44 years old, 26 years later, she was executed because she was caught plotting to assassinate Elizabeth I. So they were related, and then they are killing each other. Also, other instances, examples of age in the past, other types of age. In Islam, you have age of mumayyiz and bali. Mumayyiz is when you are old enough to know, to differentiate between bad and wrong. Bali is when you become responsible for your own actions in the religious aspect at this. And then this is the example I gave just now. Mary and Louis XIV is from France, and he became king at the age of 4 years old. So he was still at the moment he is the longest reigning monarch. And then the second is Elizabeth II. And then in 1938, Fair Labor Standards Act. This was to partially to address the problems of minors working and not attending school. So it was decided that in this act, minors at the age of 14 and above are allowed to work, and younger than 14 years old, they are not allowed to work. And even if you're allowed to work, there are certain hours that you are permitted to do so. So in 1938, they become more aware of minors, the importance of them not to, go to work and not attend school. In a more recent years or recent case, this was the sad case of Natalia Grace. So she was a Ukrainian girl. She was adopted at 6, but she was claimed to be 22 years old by her adoptive parents. But because she had dwarfism, so her features are slightly different than healthy children or average children. So they suspected her to be older than her age. I have a video, hopefully not too long for you. Okay, so that's the case of Natalia Grace. I'm not sure why they waited for 13 years to conduct a DNA test, and even they did a dental age estimation for her, and her dental age was consistent with the findings of the DNA test. And I'm really perplexed by why it took so long for them to have a more scientific approach to this. There's more stories to this, but I won't be so detailed and critical because we don't know the full story. So this is the more recent case, and where dental age estimation could be performed to confirm somebody's age, or when somebody's age is questioned by other people. Okay, so the definition of, there are many definitions of age, and one of them is a period of time someone has been alive, or something has existed, or this is more on the chronological age, your age now minus your date of birth. And also the same American Board of Forensic Odontology defines age as dental age assessment as estimation of individuals' chronologic age through scientific evaluation of the dentition and maxillofacial structures. So the keyword here is estimation. You cannot determine somebody's age. You can only estimate, because without a proper official documentation, there's no way of telling when exactly the person was born. And different people we have different biological differences. So this is why we only give an estimate, a range of dates or ages for the person's age to be identified. Okay, why is age is important? So based on the stories I told you just now, with regard to Mary, Queen of Scots, her role as a monarch or as a queen, it's very important for her to be mature before she can rule on her own rights. So one is her chronological age, 6 years old, 9 years old, blah blah blah. Also the mental age, mental capacity of somebody. You become mature mentally is very subjective for somebody to say you are mentally mature, mentally capable. So this mental age or mental maturity has been correlated, associated with our chronological age. At the age of 18, we become, or 16 in certain countries, we become responsible for our own criminal or our own actions in the legal sense. So once you reach 18, you are at the age of majority, and below that you are at the age of minority, where if you perform a certain criminal act, maybe the repercussions are not as heavy as once you've reached the age of majority, because at the age of majority, you are assumed to have understood the culpability of your actions. So also for identity, where we haven't, dental or human identification is one part of forensic odontology, and then identifying or estimating somebody's age is also a part of this identification of a person without proper identification. So age is also part of our own identity. When somebody says somebody you haven't seen in so long, suddenly comes up in your conversation, and then the age doesn't match your experience with that person, so the identities of that person is now is questioned. That's also part of it. Age also is important to ascertain or to the age at death. This is usually with regard to anthropology, or when mass graves are discovered, for example, you would like to ascertain the age of the person when they died, because once you die, your bodily function all stops once you die. So this is how age at death is important. Also, these days, immigration is at at very high level. Wars still occurring. People flee their countries, and of course, when they flee their countries, when their houses or countries get bombed, not to be so descriptive, but it's really hard to get your official government documents to bring everything that is important for you to go to or flee to another country. So when somebody has no these identifications documents to prove their age, this is when age estimation is performed. Also, as I mentioned, there's now legal implication, criminality, marriage. In certain countries, you are only allowed to get married at the age of 18, and some countries maybe 16, and other also lower 12, depending on the countries, states, and the governments that allow marriage. So yeah, I won't talk so much of in terms of that, because it becomes political. So I don't want to be so political today. But that's the important things is for us to identify the reasons why we perform age estimation, the differences between people who've reached majority, age of majority, minority, implications, and things like that. So these are the types of ages. Not there are many types of age or ages that we have: chronological age, biological, mental, all of this, and usually we try to associate or correlate these ages with each other. For example, biological, we have sexual maturation, skeletal, dental. We try to correlate that with our chronological age, our date of birth, to see whether there's any association or the correlations are strong or not. And once you have that, you assume to have your mental, you assume to have a strong association with your chronological age also. So you presume to have matured once you've reached a certain age. Okay, how do you prove chronological age? Mentioned briefly. Birth certificates. This is the original, the OG of documents to prove your age. Okay, in our birth certificates, between countries, obviously you have your name. The most important thing is you have your name, your date of birth, your parents' names, and things like that. So when it's certified by the government, it becomes official passport and national identity card. Or I think in Indonesia, you use KTP as a national identification. And biological, this is only a few of biological indicators that are associated with chronological age. But sadly, most of our biological age stops or slows down once we've reached puberty, because the development is not as advanced when we were younger. So sexual maturation, age, height, other indicators, hair, things like that, and also skeletal age have been shown to be to have a strong correlations with our chronological age. These are the types of methods that we use. The radiographic investigations that are performed for dental age estimation or skeletal age estimation. for this one. So the C1, C2, C3, we look at that, and then this is one of the research that have been done by one of our Dr. Rabia's PhD students. Measurement of the CVP, cranial vault thickness, through CT scans. I'll more about that later. And also dental age. So as I mentioned, once it's much easier, so to speak, to perform dental examination when patient or the subject is still developing. You have, if you are presented with this kind of dentition, you know, it's a very good thing for us because there are a lot of indicators that we can assess. But once somebody has reached, you know, have no longer developing teeth, the permanent teeth have all erupted, and no more indicators, at least for the developmental aspect, it's much harder to assess or to perform age estimation. And also in children or younger patients, the standard errors, the accuracy is much better when compared to the adults, where the standard errors are much higher and less accurate because of these reasons, because of growth indicators that are absent in adults. So as I mentioned, why we use teeth, or we prefer teeth for even not just for us forensic odontologists, but for other forensic scientists. Teeth are one of the most reliable or accurate indicators to estimate age. So because it's mostly more closely related to chronological age than other ages, for example, skeletal age, less affected or influenced by socioeconomic factors, you know, malnutrition, things like that. It's less influenced. For example, you know, for people in, for example, poor countries, where malnutrition is rampant, maybe their skeletal development slowed down more than the dental development. So it's less influenced by other factors. Also, dental age is, during development, it's relatively simple to assess. We'll talk a bit more about that, how to form age estimation that is supposedly easy to assess. Okay, excuse me. So these are the dental age milestone that we have. It's useful for you, not just for us as forensic odontologists, but as a clinician to know all of these milestones, you know, because once you're seeing a patient in the dental chair, a PEDS patient, for example, and you see something abnormal, or not abnormal, but you're expecting to see something that is already there, but they're not there. So you have to take a step further to investigate, to examine the patients, why, for example, why their secondary teeth haven't erupted. So you might want to perform other examinations, radiographic examinations, for example, and maybe provide a better or more comprehensive treatment for the patient. So it's important for you to know all of this timeline when you are expected to see all of these developments to occur. So we have before birth, deciduous calcification and united line to be present, and 0 to 6 years, as we know, deciduous teeth developing, erupting, exfoliating. But at the same time, this is what we see in the clinics or in the chair. But in bones, secondary teeth are supposed to be developing already. And at the age of 6, we are expecting to see secondary teeth or permanent teeth to erupt. And at 16 to 20 years, that molar development. Okay. And then 21 plus years is already considered dental aging. So this age, 20 16 to 20 years. In certain countries, the research on this is very important because of the immigration problem, especially in the European countries. All right, just a few examples of dental methods for children and sub-adults. We have Atlas method. This is Al-Katani. He was one of my supervisors, PhD student. So this Atlas came out when I was a BDS student. So it's been quite a while. She was very proud of this Atlas. So I'm presenting to you guys. Okay, so we have an Atlas method based on the pattern of eruption. When I was in the BDS years, we were expected to, well, not memorize, but to know all of this pattern of eruption. When we see a PITS patient, we are expected to be able to answer, okay, what is the age range that you suspect or you expect this patient, you estimate this patient to be. So it was a huge part of our BDS curriculum in the PITS department. Because I would like to reiterate, if you know your patients are not developing as they are supposed to, maybe if you provide an early treatment refer to your pediatric dentist or orthodontist, maybe the patient's dental health be a lot better if then compared to if you're not aware of this development or eruption phases. Another one is a morphometry or open faces measurement. This is an Italian forensic odontologist, Camerier, if I'm not I pronounce it correctly. So it measures the pulp and tooth ratio, and then it correlates with chronological age. And this is the most famous, most commonly used method in dental age estimation for children and sub-adults, staging method. This is the Bayesian method. We have other methods that have been developed, but I think this is the most commonly known or commonly applied in throughout the world. So we have the development of our permanent teeth are subclassed or categorized into 8 stages. The problem with this is it does not reflect the actual development or the actual situation of your patients. For example, if the tooth is somewhere between F and G, there are ways to the mission has already provided certain criteria for you to classify that. But still, when you have inexperienced clinicians that perform this age estimation, sometimes it becomes very difficult and not reliable as well. Because in Malaysia, most of our forensic odontology cases in using Malaya at this, we receive a lot of age estimation cases. Also in our general government practice, sometimes the police they don't know where to refer the cases, so they refer to the general dentist to perform age estimation. So we've had occurrences where our friends, our colleagues, call us, can you help me? We need to perform age estimation. Can you teach us in overnight to how to perform this? It's not as it seems simple, but it's not as easy as that to just train you in just overnight for you to be able to perform it reliably and accurately as well. So at the moment, with our undergraduate elective project, we are conducting research to whether it's enough for inexperienced practitioners without postgraduate qualifications to perform dental age estimation methods, whether they are without training, and compare their results with some training, whether it's enough for them to perform it reliably and accurately. So this age estimation for this patient, we combined the findings of different methods, and we come up with a conclusion. So as I mentioned just now, it's important to give a range of age. It's not just one age because of the variability different in individuals. Right, for this one is for the adults I mentioned. It's quite difficult. You can perform a radiographic method. This is also two-dimensional radiographic investigation. So I haven't touched upon 3D yet, but this is just the typical or the commonly used methods, radiographic methods, IOPA. Radiograph, and this one is a histopathological method, which is quite difficult. You have to extract the tooth, so you cannot do it on a living person. It's more suitable for dead bodies, and then after that you have to dissect or cut the tooth in half and perform a histopathological investigation. So it's quite challenging for adults, and even after that we don't get very accurate results. The standard errors are quite huge for this markers. So for adults, we look at the size of mostly we look at the changes in the pulp width into the methods. We see the changes. That's what we expect to have changed when we become older. So the pulp canal becomes smaller due to the tertiary and secondary dentin. So that's one of the things that we look at. Also, for this one, we look at the gingival resection, attrition, things like that. But as you know, not just old people have gingival recession, attrition. Some people, young people nowadays, we do have that kind of problems as well. Stress, health problems. So it's not a very reliable method to use. Okay, so this the latest or not? The latest updates on our methods that have been performed by our lecturers and researchers and also students at University of Malaya. So this is our faculty. So this is our preliminary finding from the previous undergraduate projects. We use Morris method to estimate age based on just one tooth. So we use permanent first molar, and then this was our finding. We haven't published this yet, but we are we're expecting to have this published as soon as possible. Hopefully, Dr. Rabia, and myself can expedite this process, but we'll see. So this is the method is the accuracy is quite it's not great, but it's okay. It's a start. The standard error was about 1 year. So for a dental estimation, we want to have smallest errors as possible, so that we are able to give an accurate estimate. This is part of my PhD study. investigation of crown ratio where I measured the root length compared to the crown height. This is my PhD project was mainly for reliability, because as I mentioned earlier, what do you do when the tooth, is somewhere between R half and root half and root 3/4. So how do you stage that? And some methods like Morris, they don't provide any criteria that you have to fulfill for you to be able to stage that accurately. Later, I will talk about accuracy and reliability, how they are different than each other. And so this was part of my study where I used the ratios to reliably stage or decide which stage the tooth belongs to. So the accuracy of prediction based on the ratios were quite high for all teeth. We have at least all of them are above 80%. And based on the stages, all of the confidence in using crown ratio in predicting the correct stage was also high. All of them are above 90%. This is not so recent, but we are still doing performing this study on other cases. This is the investigation of the surface area of the developing third mandibular third molars apices. So this is the apical surface of the third molar, and by using CBCT, we measured the apical surface, and we developed regression models based on that to perform age estimation. So for this kind of research, the applicability is quite difficult, because for everyone to be able to use CBCT, it's not as universal as compared to 2D radiographs. Also, for people to be able to replicate or reproduce the same techniques, it's also difficult when using CBCT data. So we've performed, I think, mostly on permanent teeth, and also we've investigated whether impacted teeth, impacted molars have any influence on dental age. This is also one of the studies. So if you remember the methods by Italian forensic odontologist earlier, he was using the 2D radiograph. So he measured the not surface area, just the area on the 2D radiograph. But for this one, we used again CBCT scans. We measured the volume of the pulp, and then compared to the tooth volume as well. So it is more representative of the real condition of the tooth as compared to this surface body area into the radiographs. So what we find, this is for adults. The estimated age was 65 or 60 years old with only 1.9 years. So, for adults, usually we have the errors probably can be about 10 years just by using the older methods. But with this method, we are able to get quite a small standard deviation here, standard errors. So it was quite a successful research by one of our PhD students, ex-PhD students. As I mentioned also, this was one of the PhD projects by one of Dr. Rabia's students. And also we have our oral and maxillofacial radiologist who is very involved with the with our forensic odontology unit, Prof. Noliza Ibrahim. So Dr. Nabila investigated the cranial board thickness of these landmarks. And she's published this paper. I think you can find it online, based on these age groups, only in the younger patients. So with these other regression models are very common for us to use in dental age estimation. So sometimes we use skeletal age, and then we combine that with dental age to to get the estimated age. Sometimes you do it separately, but then when you are reporting and when you write the report, you report all the findings, and after that only you try to come with the closest age that you think is based on their findings, you come up with a conclusion. So the challenges and the future with regard to dental age estimations, I think to come up with a new technique, it's very difficult. What we do usually, we develop from from the older or previous methods, and then we develop to get a better precision. So the challenges, staging technique, such as the Bayesian, so it requires all teeth to be assessed. Sometimes you only need 7, sometimes you need all 8. So it's difficult when patients, sometimes they don't have all 7 or all 8 present in their mouth. So that's why our elective or undergraduate elective project, we investigated dental age estimation just by using one tooth, so that you don't have to perform panoramic radiograph. You can only perform just one radiograph, for example IOPA. So it's much we provide an option in such cases. Also, as I mentioned earlier, 2D and 3D imaging techniques. With regard to ethical issues, CBCT is obviously more radiographic exposure for the patient. So whether it's ethical or not to perform that, to expose the patient to so much radiation when you have 2D techniques. So that's a question that we can ask and debate. Access, as mentioned, 3D, CBCT, CT scans are very hard to get in rural areas. So in Malaysia, we have many government hospitals without the 3D imaging modalities. Reproducibility, whether other practitioners, other scientists can perform the same way as you perform. So this is what reproducibility means, whether other people can reproduce your techniques and results. So for the more difficult, the more advanced your technique, sometimes it's less reproducible. Maybe it's more accurate, but it's not as easy to replicate. And this is one of our biggest challenges in UC Malaya, because we receive cases from social welfare. The majority, 99% children with small children with parents abandon them. They have no parents to take care, and then without documents, and the heritage or the ethnicity of the parents are sometimes unknown, sometimes are very mixed. We have a lot of migrant workers here. We have from Myanmar mixed with Bangladeshi sometimes, and Indonesia mixed with Malaysian. So we have no idea how this will affect dental age estimation that we perform, whether it's still which data that we can use, because sometimes it is very the ethnicity of the subject is quite sensitive, or dental age is sensitive to that. And these days, I think even in the Western countries, they prefer to use population instead of ethnic specific data. So this, it's 21st century. Everybody is mixed with something. We are mixed with something when we are never pure, because it's been thousands of years of mixture. So it's, I think, more appropriate to use a population specific data rather than ethnicity. Maybe in the future, maybe we can have a collaboration with other countries to have more comprehensive data to tackle this issue. And as I mentioned, accuracy, reliability. Accuracy is to have your results as close as possible to the true value. An accurate method does not mean it's reliable. Reliable is the ability to be able to have the similar results. Sometimes your similar results is somewhere out here. Okay, that's very far from the center. But every time you perform, your results is here. So that's very reliable, but it's not accurate. Sometimes your results are accurate, but it's just somewhere it's not consistent. So reliability is more about consistency. In our dental age estimation research, we have a lot of papers, a lot of articles talking about accuracy, but not so much on reliability and how to handle this kind of problems. Whether other scientists from Malaysia can reproduce the technique that has been performed or produced by scientists in Indonesia, for example. So it's very important for us, for other scientists, to be able to replicate that method, so that we have both accurate and reliable method. So these two are very, they're not the same, but very important to have. And as of course, you cannot talk about age estimation without these two words, artificial intelligence. I think for myself, I'm very I'm a millennial, but sometimes I feel like I'm a 70 years old man. I'm very scared of technology, but I think we shouldn't be. We have to embrace. Maybe the younger generations can help us with this technology stuff. And these days we try to change our methods that are very reliable on humans, and we try to do that to get the computers to do it for us. So maybe we can find a balance. It doesn't have to be all AI or all humans, somewhere in between. Also, the last one, funding, time and power. Sometimes we have the greatest or the best ideas, but sometimes we don't have the funding, sometimes we don't have the time, and sometimes we don't have the manpower to materialize our ideas. I think that's it. I think it's also 12 o'clock now. These are some pictures of UC Malaya for you to enjoy. I only choose the nice ones, obviously. Hopefully, if you come to UC Malaya, please contact us. And myself, Dr. Rabia, we are very welcome to come and visit. Maybe we can collaborate further in the future. So that's it for me. Thank you so much.
Okay, thank you very much, Dr. Amir, for your insightful presentation. So, ladies and gentlemen, now we move to Q&A session. So you may raise your hand to ask questions directly, or you may also drop your question into chat box. Okay.
So everyone is not so tired after 2 hours.
Okay. Prof. Mika has a question for Dr. Amir. Please, Prof. Mika.
Yes. Thank you, Dr. Arafi, for you give me time for question to Dr. Amir Haswan. Thank you, Dr. Amir Haswan, for your providing a good lecture this afternoon. So I will make a question. How do you think there are many methods for its estimation, remembering it is many influence? Which one do you think it's better than many methods for its estimation?
I think that
Sorry. I think the right one is every population with a different culture. So depending of maybe the different culture or different habit, it is you agree it is my statement, or how about the every method for the every population?
yeah, I do agree with you. There's a obviously every population they have different methods that are very accurate to that specific population. You have to consider other external aspects as well. As I mentioned, for example, with malnutrition, obviously advanced or developed countries, maybe they're not so influenced by that, they're affected by that compared to a country in Africa, for example. So there have to be sufficient data, sufficient research to suggest or to show this which kind of method that is that's more accurate to this population. But for Malaysian population so far, we find that dental is more the most not just accurate, but then most practical to use.
Yes, and the second question is, I think in the future, Dr. Amir, we have many mixed population. I think because many we have mixed marriage. So
Yeah.
I think the old methods will be changed. Are you agree that one?
Yes. There's also it, but this is in Europe. By my supervisor, she's collected data from different populations.
Patrick's, yeah.
No, Liversidge, Helen Liversidge in Queen Mary. She's collected all these different ethnicities. There's very little difference in terms of the population that she investigated, but it's not comprehensive. But in terms of University Malaya, because of our cases that we see, we like to see more data in the Southeast Asia region.
Yes.
Hopefully we can have that collection of data for us to have, so that we can just we can see, if there's no little difference, then maybe it's not a problem if there's an intermarriage in between South Asian populations. Maybe, but we have to have, like I mentioned, we have many issues in terms of funding, manpower, things like that, to proceed with this. But it's a challenge that we have to take, I think.
And how about the artificial intelligence? Is it good for its estimation, measurement, or?
We are very new to that.
Yes.
To that aspect. Especially in terms of expertise, dentists, we have to, now we have to collaborate with other faculties or other fields. We at the moment we are starting to get grants, to find grants for that as well. So I think maybe it's the future, but at the moment it's the semi-automatic, as the most popular one is semi-automatic method.
Yes.
Not yet the AI, artificial intelligence. We have to be very careful as well with the technology.
Yes, thank you. And very complicated, I think, artificial intelligence. for
Yeah,
its
thank you so much.
estimation, especially
Yeah.
for its estimation.
Yeah.
Thank you, Dr. Amir.
Thank you.
Thank you, thank you.
Thank you.
Thank you, Dr. Arafi.
Thank you very much, Prof. Mika, for the question. Maybe another question from student, please. Any question? Okay, if there is no more question from the audience, then I would like to say thank you to Dr. Amir for a wonderful session. And we would like now present a digital certificate of appreciation to Dr. Amir Haswan Abdul Rahim. We are deeply grateful for his willingness to share his expertise with us today and for his outstanding contribution as a speaker. The certificate will be presented by our professor, Professor Mika, please.
Thank you, Dr. Amir Haswan, for your pretending afternoon lecture today. Once again, thank you. Thank you very much.
Thank you so much. Thank you so much for
This
having me.
yes, this is your certificate.
Thank you.
Thank you very much, Prof. Mika and Dr. Amir. So, ladies and gentlemen, before we close this session, we would like to capture this moment with a group photo. So, may I kindly request all participants to turn on their camera. So, for students, please turn on your camera and we will take group photos together. Okay, please turn on your cameras. I will capture the photo from the first slides in my computer screen. 1, 2, 3. Okay, we move to the second slide. 1, 2, 3. Next slide. 1, 2, 3. The next. Okay. The last one. One, two, three. Okay, thank you. For the participant, please wait a second to fill in the attendance form. I will share in the chat box for the attendance form in this session. Okay, so please fill in the attendance form and to get your certificate. Okay. Once again, I would like to thank you for our speaker, Dr. Rabia and Dr. Amir for the presentations. And on behalf of the Stovit Online Studies Committee, I would like to extend our heartfelt gratitude to our distinguished speaker, Dr. Rabia Al-Adawiyah Rahmat and Dr. Amir Haswan Abdul Rahim for sharing their invaluable knowledge with us today. Your contribution have made this event truly enlightening. Okay. And to all participants, thank you for joining us and actively contributing the discussion. We hope to welcome you again in person for future project and event. So please remember to complete the attendance form provided in the chat box, and we look forward to your participation in the next Stovit Online series. Thank you very much. for coming today, and wassalamualaikum warahmatullahi wabarakatuh. Thank you.